This segment sponsored by GBMC Healthcare.
So while prostate cancer can be common in some men, we know that the preventative care makes all the difference.
I stopped by GBMC to hear more about why prostate screenings are vital for men's health. Take a look. Prostate cancer affects more than 3 million men a year, but despite how common it is, there are still some important facts that you should know. So we're here today at GBMC with the Vice Chair of Radiation Oncology, Dr. Geoffrey Neuner. Well, thank you for joining us.
Thank you.
All right, so tell us all about prostate cancer. Let's start with the screening recommendations. What are they?
Okay, so the screening recommendations have changed, and there's been change over the years that have been a little bit confusing. So for a while, screening was done for men over 50 with a PSA. That was discontinued by our National Preventative Health Task Force, but it was thought that that was too far in the other direction. So now the recommendations basically say that for men ages 50 to 69, it should be a discussion between them and their primary care doctor that should be had regarding the risks and benefits of screening.
Okay.
And that it should be an individualized decision based on, risk factors, patient concern, and any other variables that may be at play.
Now, prostate cancer is pretty common, right? So what are some of the signs and symptoms?
Well, so in this day and age, it's really actually kind of uncommon to have any signs and symptoms, and that's why screening programs are in place, because we want to catch cancers before they are causing any problem. This is often kind of psychologically jarring for the patient because you tell them they have cancer when they don't have any symptoms, and it doesn't make a whole lot of sense.
Right.
But that is the reason to have a screening program, so that you don't have patients coming in with symptoms. However, for advanced cancers, you could have obstruction of your urination, blood in your urine, even obstruction of your bowel movements. So those are things we saw by and large more in the past than we see now.
Is there anybody who's at higher risk?
So patients with a strong family history of prostate cancer, patients with a family history of cancer in general, especially one that's linked to an inherited predisposition to developing cancer. There is definitely data showing that African American males are at higher risk of developing cancer and also of dying of prostate cancer. So those are the major ones that we tend to focus in on.
Okay, so we hear it is pretty common. What's the typical course of treatment for prostate cancer?
So, it really depends on your what we call risk grouping, and that risk grouping relates to both the curability of the cancer, how likely it is to spread, how deadly it might be. But in all cases, for localized prostate cancer, treatment is really an insurance policy for the future. We usually don't think it would be affecting a man in the next few years after the diagnosis. So it really depends on the risk grouping. Low-risk patients, very low-risk patients are by and large now offered surveillance, which is not treatment, it's keeping an eye on the cancer. As your risk grouping goes up, the treatment options include surgery, radiation using external beam radiation, radiation using a radioactive seed implant. Those radiation options are often combined with hormonal therapy that takes away a man's testosterone for a period of time when the risk grouping is even higher.
Okay, and where can people go to get more information about what you do here and prostate cancer?
So GBMC has a website where they can find information. Also, Chesapeake Urology is a good resource. The American Cancer Society has a lot of information on prostate cancer as well.
Dr. Geoffrey Neuner, thank you so much for being here with us today and for giving us all that great information.